Good evening, class. This presentation is on diabetes by Jamie Blake and Kenya Allen. Diabetes is destroying many lives in the state of Georgia. These lives could be saved if enough community outreach and guidance is given to these individuals at a younger age. Diabetes basically is a metabolic disease in which the person has high blood glucose, also known as blood sugar, either because insulin production is inadequate or because the body cells do not respond properly to insulin, possibly both. Chronic conditions such as strokes, heart disease, obesity, diabetes, and cancers have been on the rise every year. According to Atlas, chronic conditions account for approximately 75% of the medical costs in the United States. The total estimated cost of diagnosing diabetes in 2012 was $245 billion, including the $176 billion in direct medical cost and $69 billion in decreased productivity. Decreased productivity includes costs associated with people being absent from work, being less productive while at work, or not being able to work at all because of diabetes. People with diabetes aged 60 and over are 2 to 3 times more likely to report inability to walk 1/4 of a mile, climb stairs, or do housework compared with people without diabetes in the same age group. Diabetes is the 7th leading cause of death in the United States. Due to the complexity of chronic conditions, especially since they are most preventable, it seems feasible to approach caring for patients through the view of treating the whole man, mind, body, and spirit. The state of Georgia accounts for approximately 9% of the 29 million people in the United States that are suffering from diabetes. The prevalence of this disease increases with age in the state of Georgia. Elderly Americans in Georgia tend to have a higher prevalence than the rest of the population at a rate of over 24%. Now, in the state of Georgia, it's obvious. It's a huge concern. It is estimated that 1 million suffer from this deadly disease. 350,000 of whom don't even know that they have it. If present trends continue, it is estimated that 1 out of every 3 children, 1 in 2 minority children, faces a future with diabetes. African American elders with diabetes are significantly higher than other ethnic groups at a rate of 23% in comparison of Caucasian, only at 12%. Diabetes prevalence increases with age. Georgians 65 years of age and older had a significantly greater prevalence of diabetes than any other age group at 23%, which was 9.6 times the prevalence of diabetes among 18 to 24-year-olds. The issues that the diabetic elderly African American population of Georgia faces are vast. Many will encounter additional chronic illnesses as a result of their diabetes, such as heart disease, stroke, hypertension, blindness, and other eye problems, kidney diseases, and amputation, just to name a few. It's said approximately 78% of elderly African American in Georgia reported to have access to a regular primary care doctor. In addition, the state of Georgia ran and local agencies on aging reported to provide nutritional counseling and various diabetic-related services to approximately 11% of elderly African American population. That is a very low number. There are assessment tools used to diagnose, monitor, and investigate diabetes. Physicians utilize assessment tools such as the A1C test, which measures blood glucose averages over 2 to 3 month period. The fasting plasma glucose test, also known as FPG, is a quicker method, which assesses fasting blood glucose levels. The oral glucose tolerance test, also called the OGTT, measures how the body processes glucose over a 4-hour period using a special sweet elixir. Lastly is the random, also called casual plasma glucose test, which can be administered any time of the day for those who are displaying severe symptoms. Once physicians diagnose a patient with diabetes, a specific treatment plan and health monitoring is put into place. A typical diabetic treatment plan may include drug therapy, diet modification, increased exercise regimen, and consistent glucose testing and monitoring. In the elderly African American population, diabetes assessment is particularly important due to the high risk factors in both the elderly and African American population. Elderly African Americans, are more prone to accelerated conjunctive decline due to poor health monitoring. In the state of Georgia, there are many local agencies that also provide diabetic resources to the elderly African American population. The Diabetes Association of Atlanta provides free screening, educational classes, and in-home services not only to the elderly African Americans, but in all the Atlanta metro area who are suffering. In addition, the agency promotes diabetes awareness within the community by holding health fairs with various organizations. The American Diabetes Association, Atlanta, North Georgia Region Office, is so committed to educating the public about how to stop diabetes and support those living with the diabetes. They have put together numerous events and fundraisers. The most recent are Step Out Atlanta and the American Diabetes Association Expo. Step Out was just that. It was a walk for diabetes and to raise money for these people in research. These people were not only out there exercising, but they were supporting a good cause. The expo was a free event that included health screenings, cooking demonstration, product and service exhibitors, as well as leading experts talking about diabetes management, research, and prevention. The free health screenings included blood glucose and blood pressure. The Georgia Diabetes Coalition, also known as GDC, is also an organization that serves as a unified voice for members dedicated to improving the quality of health for those with and affected by diabetes. They have implemented the 2020 campaign. This is a digital media campaign conducted by the Georgia Diabetes Coalition, which they dedicate the 20th of every month to the awareness of diabetes and its complications. As a part of this campaign, they provide monthly messaging and patient education materials to hospitals, employers, churches, pharmacists, and diabetic educators around the 4 most common diabetic complications, which include blindness, amputation, kidney failure, and DPN. What else can be done? How can we help people with diabetes? How can we get the message out there? Well, I think the most important factor when it comes to diabetes, obviously, How are we going to prevent this? What could the community do to ensure the message is getting out there to everyone? A thought was that the school districts could come together and implement a prevention class so that the younger generation is understanding the seriousness of these issues, what they can be doing now, today, to prevent this. Diabetes is also caused from obesity. So these schools need to also be explaining the importance of a healthy diet and plenty of exercise. According to the Mayo Clinic, there are many benefits to regular physical activity. Exercise can help you lose weight, lower your blood sugar, boost your sensitivity to insulin, which helps keep your blood sugar within a normal range. It shows that both aerobic exercise and resistance training can help control your diabetes. But the greater benefit comes from a fitness program that includes both. Again, on the front line, stakeholders. Diabetes Association of Atlanta, serving over 13 Atlanta metro counties. They're out there to make changes through advocating state leaders and Congress to provide additional funding and research resources so that not only that community, but the state of Georgia, the entire state of Georgia, is receiving the help that they need. That our future generation is understanding the importance of proper diet, proper exercises. That way they can prevent all diseases. Thank you, and have a great evening.